I
I
solemnly pledge
solemnly pledge
myself
myself
before God
before God
and in the presence of
and in the presence of
this assembly
this assembly
to pass my life
to pass my life
in purity
in purity
and
and
to practice my profession
to practice my profession
faithfully.
faithfully.
I will abstain
I will abstain
from
from
whatever is deleterious
whatever is deleterious
and
and
mischievous
mischievous
and will not take
and will not take
or
or
knowingly administer
knowingly administer
any harmful drugs.
any harmful drugs.
I will do all in my power
I will do all in my power
to maintain
to maintain
and elevate
and elevate
the standard of
the standard of
my profession
my profession
and will hold in confidence
and will hold in confidence
all personal matters
all personal matters
committed to my keeping
committed to my keeping
and
and
all family affairs
all family affairs
coming to my knowledge
coming to my knowledge
in the practice of
in the practice of
my calling.
my calling.
Yes, dear friends, we have all chosen or joined this noble profession nursing by choice or by chance by taking Florence Nightingale pledge. But sometime we also felt it is horrible profession what we have chosen when we entered first time in the hospital. We came across with many patients and listened their painful words and feelings and did so many procedures on them and took care of them as if we are one of the family member of a patient. We act as mother, brother and sister, friend and caretaker to all of those who all are coming under our service. After recovery of patient, we felt so good and grateful when patient says thanks to us for taking good care. Then we realized nursing is not a bad profession. Here, what I mean to say is, nursing is one of the best professions among all health professions because nurses are the backbone of hospital and doctors as well as patients. Nurse act as caregiver, advisor, caretaker, advocate of a patient, educator, counselor and so on. But what is going on in nursing profession? We all are practicing outdated nursing skills till today and also teaching to our students the same procedures. For example, urine sugar test till we are dependent on Benedict's solution which is outdated now and our leaders are not accepting the change and not allowing the student to use the strips to check the urine sugar. Still, we are using fetoscope in our community health nursing bag as stethoscope itself has fetoscope. Friends, we all have faced many problems while learning nursing and still facing the problems while working also. Hence, what we need to do if we are born to be this nursing profession, then it is our responsibility to upgrade the nursing profession and bring some changes or modify older procedures which will help us to solve many problems. Yes, friends, we can do it. Now, question arises in our mind how to do it. If we say like that only, then the people will accept it. If not, then what? Friends, if you want to do something before, you need to search, think and formulate a question in your mind about the particular problem. Once the question is ready, then check that question is valid or not. If it is valid, then search whether anybody have tried to solve that question. If solved, then what method and materials they have used to solve it and what was the result. What I mean to say is we need to generate the new things or knowledge or procedures or modify the procedures by doing research. Yes, friends, here I am talking about research. In our nursing profession, research is one of the toughest subjects for most of the students. If you understand it, it will become very easy. If not, then it becomes too tough. Yes, here I will try my level best to make you understand the research in simple and easiest way. If you have not yet subscribed our channel, please subscribe it now and press the bell icon to get regular notifications whenever we upload the new video or keep the live sessions. And do not forget to share your friends. Friends, once again I would like to welcome you all to Professor Chanagiri Nursing Education Tutorials. Today in this session I am going to make clear you all about what is research, and let us begin with Introduction to Nursing Research. The first question arises in our mind, that is, what do you mean by research? Yes, research. If we divide this word into re and search, we may get an idea about research. That is, re means again and again or repeatedly, and search means finding out, and here it is finding out new things. So, research is nothing but it is finding out new things again. Friends, so many authors define research in many ways. Among that, here I want to quote some meaningful and easily understandable definitions of research. Before that, today we learn about what is the meaning of research. According to Webster's New International Dictionary, research is a careful inquiry or examination in seeking facts or principles, a diligent investigation to ascertain something. By this definition, we can stress on main two words, that is, careful inquiry and investigation. Means here simply studying the facts may not give the results but need to be deep verification about the facts. For example, today almost all countries are trying to find out best solution for COVID-19 pandemic. Here, so many bioscientists are engaged themselves in bringing out the vaccine. Here, what they are going to do? They clearly examining the coronavirus, means they observed the virus in terms of its genetic formulations, lifestyles of coronavirus, means how it multiplies in human cells, what is the temperature required for its multiplication, up to what level it resists the temperature, how many minutes or hours it survives on the materials commonly used by the human, for example, plastics, wood, metal, etc. How it spreads from one person to another person. After this all careful examination, they released a note that coronavirus is a droplet infection and it enters human body through nasal and oral cavity. It produces signs and symptoms common to common cold and in severe situation respiratory failure in older adults and small children below 5 years. And also they have given the tips to prevent the spread of infection. That is why, to avoid the contact, the majority of the countries have announced lockdown. But common man does not do this all. He does not examine seriously, but when exposed to the disease, then he may say what all the trouble he faced due to the disease. So, without careful examination, we cannot find out the facts about what we intended to find out. Now, we came to a conclusion that research is a scientific study because it involves careful examination or investigation. Results of the study are verifiable because materials and methods are clearly mentioned in the study and anybody can test it. And research is scientific search to a question. Sorry, answer to a question. Dear friends, in today's session, I hope all of you have understood the meaning of research. And next session we will discuss about the various definitions given by various authors about research. Till that time, take care. Bye bye.